Good afternoon, everyone. Thank you for coming back, and hopefully those that are still out in the poster session are going to work their way back in to the main hall here. We do have a very important panel here that I'm excited to tell you a little bit about and introduce our panelists for you. And we're going to have a question and answer session at the end of this. So first, let me welcome you back. This is going to be a really important panel that affects the work that I do at USDA, and I think the topics that we're going to discuss likely affect the work that many of you do in communities all over the United States. The number of Americans aged 65 and older is projected to more than double from 46 million today to nearly 100 million by 2060. That's according to the census. By 2060, people aged 65 and older as a share of the U.S. population is going to rise from 15 to nearly a quarter of the U.S. population. Aging adults experience higher risks of chronic disease. In 2012, 60% of older adults managed 2 or more chronic disease conditions. Among the chronic disease conditions they're managing and experiencing are diabetes and cancer. We wanted to bring together a diverse panel of experts to help us focus on those at-risk populations, and perhaps more importantly, what we can learn about the choices and resources they rely on to stay healthy. Let me first introduce to you our panelists. Each of them will speak for about 12 minutes, and then I'll come back to the podium so we can hear from your questions and you can talk directly with our panelists. Let me get started. Our first speaker is Dr. Uche Akobundu. She's a registered dietitian and the senior director of nutrition strategy at Meals on Wheels America, where she leads the development and implementation of the association's strategies on nutrition and malnutrition. She is also director of the National Resource Center on Nutrition and Aging, awarded to Meals on Wheels America by the Administration for Community Living of the U.S. Department of Health and Human Services. Dr. Akobundu holds a master's degree in nutrition with a concentration in public health from the University of Massachusetts Amherst and a PhD in nutrition from the University of Maryland. Our second speaker, Sacha Uelmen, is a registered dietitian and director of nutrition at the American Diabetics Association. Sacha's prior experience has included work in adult diabetes education with the state of Michigan's Health and Human Services Department. She has facilitated group type 1 and type 2 diabetes education classes and became a certified insulin pump trainer on 4 brands of insulin pumps, as well as both continuous glucose monitors. She founded and facilitated a type 1 support group at the University of Michigan as well. Sacha grew up in Flint, Michigan, where her father opened a pita bread bakery and the first Mediterranean food market in the area when she was a toddler. Sacha worked in the bakery and helped her father prepare authentic Lebanese foods throughout her childhood and teenage years, which strengthened her passion for food. She earned her BA in sociology from the University of Michigan and her BS in dietetics from Eastern Michigan University. Sacha's in the middle. And finally, to complete our panel of registered dietitians, we have Colleen Doyle on the end. So Colleen is a registered dietitian and currently managing director of nutrition and physical activity for the American Cancer Society. She has worked in health promotion for more than 20 years, including developing strategies to increase awareness of the importance of diet and exercise for chronic disease prevention and management. She worked to create changes in schools, work sites, and communities for healthy lifestyles. Colleen has extensive media and public speaking experience, including appearances on CNN, Headline News, Discovery, and Discovery Health. She's frequently quoted in nationwide publications, including USA Today, The Washington Post, The Los Angeles Times, and consumer magazines like Better Home and Gardens, Glamour, and Fitness. She's also co-author of the American Cancer Society's Great American Eat Right cookbook and has contributed to a variety of other books and cookbooks. She is a frequent presenter at both scientific and consumer meetings like these, and the author of numerous scientific and consumer articles on nutrition and physical activity. Colleen has a Bachelor's of Science in Nutrition from Miami University and a Master's of Science in Human Nutrition with a minor in Exercise Science from the University of Ohio, or Ohio State University, I'm sorry. I'm stepping in something there. So thank you all for being here. I'm going to hand it over to Uche, who's going to start, and then we'll be back after each of them has spoken to take your questions.
Thank you so much for the warm introduction. It's my pleasure to be here this afternoon. So much warmer in Orlando than it is in Arlington, so super pleased to be here on that score as well. My goal here today is to talk to you a little bit about food safety risks in older adults, provide some insights and some opportunities. I'll set the stage for our wonderful panel today, talk a little bit about some trends in our larger society to keep in mind and the implications they have for older adults, and close with a call to action, things you can take home and use tomorrow. All right, so first a little bit about Meals on Wheels America. We're new to this conference, and so really pleased to be here, but you may not know, we're a national organization that supports the interests of over 5,000 community-based organizations around the country. We provide them resources such as group purchasing, research, advocacy, and communication support so that they can go out and serve those over 2 million seniors that need meals in home-based and community-based settings. So, I will start with the central premise that we all share, that foodborne illness is in fact a preventable and costly public health challenge that we can work together to attenuate with important research and practice-informed strategies to help those who are most vulnerable be able to attenuate their risk for this particular challenge. We're here today to share with you some insights about some of the most vulnerable populations. I'm going to start with those who are over the age of 60, our seniors. So here are a couple of trends just to keep in mind that are to do with nutrition and our society and how it's changing. And so I'll start with demographics. Chris so ably started with some information about how the senior population is changing in terms of its density and diversity. Perhaps you're aware that 1 in 8 older adults are immigrants to this country, and many folks immigrate in their middle years. This represents, over the course of the last 20 years, a 70% increase in this population, increasing from 2.4 million to over 4.6 million older adults who are immigrants in the older age category. This means they come already with different dietary preferences, knowledge about food handling, and expectations from the marketplace. We now have a global food supply in this country, more so to cater to these changing interests in our population. I will say, coming here 20 years ago, there was nary a Nigerian food to be found in any market. I now live in Alexandria, Virginia, where there are 2 African stores, several African restaurants. Not hard to find the foods that I have grown up with and want to eat. This is definitely an indication of our changing food supply. As people get older, we have expectations of the kind of lives we want to lead and the foods that we feel will support that life best. There's greater interest in prevention, greater interest in eating fresh fruits and vegetables, for instance, or healthy products all times of year. We want them quickly, we want them conveniently, we want them everywhere. Food is sold in so many places that it didn't used to be sold before. What does this mean? This just means that with all of these changes, there's greater opportunity for food safety risk as we try to manage these new foods, understand how to use them, remember how best going forward in our older years to contend with new and emerging food safety risks. We know that 48 million or so Americans are challenged with food safety illnesses, and so this is really not a small problem, as you well know. Older adults are at increased risk of hospitalization and death. We know that while 13% of the older adult population do have food safety risk challenges, we know that hospitalization and sadly morbidity affect up to 60% of this population. They are disproportionately at risk for costly challenges to do with food safety and resulting illness. And why is that? That's because of 4 main real risk factors that I will get into in this brief presentation. First, let's start with physiological risk factors. These have to do with age-related changes to our olfactory, gustatory, and digestive systems. As we get older, we lose the ability to discern smells. And so smelling that cup of milk to see whether it has turned or not gets less easy to do as we get older. As we get older, we lose our taste functionality as well. So discerning when things have turned, challenging to do. Our digestive system sadly slows down, increasing our risk to toxins that our body is less able to clear and more likely to cause risk of illness. Older adults, sadly, also have larger incidences of chronic illness. The rest of my co-panelists here will be talking about some of those, but likely to have these conditions and take medications that suppress perhaps the immune systems and put them more at risk for illness. So in addition to chronic conditions and medication use, this just places older adults at greater risk. Older adults are also increasingly more likely to be in the hospital and for longer and longer durations. What does this mean? This means that, unfortunately, they're more likely to be challenged with opportunistic infection, in addition to the challenges that come with immobility and its impact on the immune system. We know that just after 72 hours of bed rest, we start to see deconditioning and, in turn, challenges to our immune system. So this doesn't take long to happen. Increased hospitalization increases this opportunity. The third to last bucket of risk are behavioral challenges. We know that older folks often have certain activities and behaviors that they want to execute around food. They say everyone's a nutritionist, right? At least 3 times a day. That's definitely the case with older folks. For instance, behaviors that you learned over the course of your life. Every Thanksgiving, I have the same struggle with my mother. Pumpkin pie, custard pie, should not be left out all day. We have this conversation all year because that is what she has learned in the past and would like to do. Older adults also have different perceptions of risk and often see themselves less at risk than they might be. I know that we have lots of older folks who have a sense of a propriety and do not want to waste food, and so want to eat everything to that very last drop, and sometimes that can increase their exposure to toxins as well. Use of the food label, what does the sell-by date mean? How do I use it? What do I know about the label? How could that inform my choices? Often different levels of awareness and use of these tools out in the marketplace. Some of the physical factors that might challenge older folks, particularly those that we serve as a national network of meal programs, are those who are homebound, for instance, or challenged with physical or other functional limitations. These individuals, sadly, are dependent on the foods brought into their home by caregivers that they're able to access. So it's so important that home-delivered meal programs, for instance, loved ones, caregivers, understand how they can play a role in attenuating food safety risk. So that senior is dependent on the foods in the home, the tools in the home to prepare and store those foods safely. And so these are the things that we need to be mindful of that place seniors at risk. Ultimately, thinking about interventions, we want to tailor interventions to the learning needs of older adults. What do they need to know? How do they like to learn? We can leverage available research in order to do this. We want to stimulate that same risk of perception that older adults might have, make sure they understand the factors that are emerging to place them more at risk. We want to help folks develop the skills that they need. We want to increase their confidence and their ability to subscribe to good food safe practices in their homes and share resources that they would like to know about food safety from trusted and preferred sources. I always like to start with making sure that folks understand what foods to avoid. If you've had a love of hot dogs your whole life, maybe it's something to think about as you get older, as those are some of the foods to avoid on this foods to avoid list. Also want to think about where do older folks like to get information. This is a recent graph looking at data from the International Food Information Council Foundation, and that blue line on the right-hand side chart there just shows that as you get to the older ages, folks like to hear information from the news. The yellow line, as you may be able to see, is from government agencies. So they're the 2 top sources that seniors like to hear their food information from, the news and government agencies. All good news for us in the room here. I have lots of resources to remember. They will be listed at the end of this slide presentation. There's plenty of resources out there from the federal government, academic institutions. There are key online resource centers, such as the one that I manage, the National Resource Center on Nutrition and Aging. We are releasing this September a food safety on the go curriculum for home delivered and meal providers, others who deliver meals on the go, so they understand how to manage their risk for those that they serve. Thank you so very much for your time and attention. I will turn things over to my colleague.
Hi, I'm Sacha. And so my passion for food safety started many years ago. As I mentioned, this is about the age I was when my father opened up our bakery. And I was obviously helping my grandmother make cake. So I think that makes everyone in this room cringe when you see what I was probably doing. Cake batter all over my face, one of my favorites. And in my dad's store, he had big bins of grains like bulgur wheat and basmati rice. He had olives, and one of my favorite things to do about this age was to dig my hand in those, my whole arm. And I was a snotty kid, so horrified. And my dad was real stickler for food safety. So, like I said, my passion for food safety started at a very young age. But before we move on, let's talk about just generally healthy eating with diabetes. So this is one of our materials that we produced, the American Diabetes Association, just kind of giving you an example of a healthy meal for someone with diabetes. One of the things that we encourage is filling half of your plate with non-starchy vegetables. Non-starchy vegetables don't affect your blood sugar, and then the other half of the plate is split between your grainy food or your carbohydrate foods and your protein foods, your meats or your plant-based proteins. And this is an educational tool that we have in 7 different cuisines available for educational purposes. So let's talk about prevention. You probably know all these things, but one of the biggest things is washing your hands, making sure people with diabetes are making sure to wash their hands. But because we're pushing non-starchy vegetables, raw vegetables, any kind of vegetables, just eat them, it's important that we stress these other important messages to make sure they wash their hands and they wash their fruits and vegetables, just following general food safety practices, but also thinking about people who were trying to get cooking more. So a lot of people maybe with diabetes are starting to realize they're newly diagnosed, they are more likely older adults, and maybe they haven't cooked a lot. And so they're learning new things and maybe not following those practices. So it's very important. I pulled this from the Fight Back website because produce is such an important message that we have. So just going through these prevention techniques, checking for bruising or damage to your fruits or vegetables, cleaning your hands, cleaning your surfaces, washing your produce. I often recommend to my patients to use a salad spinner because I really want them to wash all of their produce, even those bagged lettuce things that say triple washed. I would tell them still wash them. But the salad spinner helps and makes it a little bit more fun. Kids can help out. So, and then now the question of why does diabetes increase your risk? I'm sure people with diabetes are really tired of hearing what they're at increased risk of because they are at increased risk of everything. And so to talk about why, understanding a little bit about diabetes and how it affects your body. So diabetes is basically a problem that affects how your body processes glucose or blood sugar. And it may be tough to make insulin or it may not make insulin at all if you have type 1 diabetes. And so when your blood sugar is high, it also slows everything down. So if I think of it as if you're drinking, your blood should be like the consistency of orange juice. But if your blood sugar is really high, imagine taking a straw and trying to sip through molasses. So that would be a high blood sugar, the difference in consistency. It's a lot thicker, stickier, and it just doesn't move through your system as well. And so that's why I have the picture of the snail, because it reminds you of just everything kind of slows down. So your digestion is going to slow down, meaning that food is going to sit in your gut longer. Your immune system, your white blood cells are affected, and your immune response may not be as quick because you have diabetes. And so food can sit there longer. Someone without diabetes it might pass through and you don't get sick. Someone with diabetes is at increased risk of getting sick. And then same thing with the kidneys. As your body's trying to filter things out, it just doesn't work as quickly, especially as you age and you've had diabetes longer. So the kidneys, things sit there longer. It can make you sick. So special considerations to think about when you have diabetes. Thinking about, my husband had really bad foodborne illness a few years ago. It was Christmas Eve. It was terrible timing. He was in bed. He kind of looked like this for 3 days. I was really worried about him, but he doesn't have diabetes. So I just checked on him regularly. But being sick with anything, whether you have a cold or the flu or just a little bug, increases your blood sugar. And so that also, again, kind of can increase problems. Vomiting, diarrhea, fever can also increase dehydration, which also can increase your blood sugar. But don't be as sure that it's going to increase your blood sugar, because if you're not eating and you've been vomiting, it might lower your blood sugar. So it's kind of complicated. And then you have to decide, do I take my medication? Do I take my insulin? I'm taking insulin 3 times a day at meals. Do I take it all? Do I take some of it? Do I take my long-acting insulin? So these are all things that people have to consider when they get sick, or if they get sick. So what to do if the bug gets you? If you have type 2 diabetes, one of the most important things is to have a plan. Most people in diabetes education, we're going to train you to have a sick day plan. What happens when you get sick? With foodborne illness, I would probably raise that to a little higher level. Make sure you're checking your blood sugar frequently. If you check it once a day, I would suggest checking it at least 4 times a day, or if anything feels off. And if someone's there with you, making sure they're checking on you regularly, because if you're exhausted and sleeping, want to make sure you're still conscious if you're taking medications that are going to lower your blood sugar. So planning for your meds, knowing with a doctor, if you were to get foodborne illness, what do? Do you take all your medication like you normally would, or is that going to put you at increased risk? And know when to call the doctor, when to go to the hospital, because you are more likely to need to go to the hospital from foodborne illness if you have diabetes. Now, type 1 is a little more complicated. You're still going to want to check your blood sugar more often, but then there becomes decisions on which insulin to take. Do you take it? Do you take some of it? Continuous glucose monitors have come a long way, so that's great if people have those, but everybody doesn't have access to those. So it's really important that someone with type 1 diabetes also thinks about their hunger level, because if they're taking their insulin, which they need, even if their blood sugar's low, they need to sip on something with carbohydrates in it. So now's the chance to drink that Gatorade. I'm from Michigan. We drink Verner's when we're sick. It's a ginger ale. Most people think it's gross unless you're from Michigan. But it's pretty good. And so that's an excuse for someone with diabetes to drink something with a little sugar. So we do encourage people to have those things on hand for sick days, and this would be an important time to be sipping on those things to make sure your blood sugar doesn't drop too low. And then also I would encourage someone with type 1 to check their ketones, because if you're sick and vomiting, you actually can go into diabetic ketoacidosis at a much lower blood sugar than you would if you were on a normal day. So be much more proactive and vigilant. And so prevention, I have a list of foods that I would also recommend that people try to avoid. So as we're recommending people cook at home, there are increased risks of some things, but your risks are lower in general if you're following the right practices. So avoiding eating raw foods, obviously fish, beans, meat, poultry, cheese, sprouts, and then you probably don't want to do those over easy eggs or lunch meat if you have diabetes. And then we have a new website, and I apologize I didn't bring too many, but there's a few flyers on your tables about a cooking website. It's called diabetesfoodhub.org. My apologies, I thought I had it on the slide, but you can find it. And these are cooking recipe resources, and we're really trying to build out more recipes for people who are new to cooking, because I think the biggest concern when people with diabetes maybe get that diagnosis and realize they should be cooking at home more, then that's when risks come up. Because I had patients where they were used to cooking fried chicken, but as we encouraged them to cook their chicken differently, they weren't thinking about how is it cooked, because when they fried it, they knew how to make it cooked well. And so when they switched to grilling or pan frying, they weren't really aware of the temperatures and the thermometers and things like that. So this is a great resource to send your patients to, or your, and you can, with this website, you can not only look up recipes that are most of them are pretty basic, and we're trying to bring in simpler recipes, but also there's a meal planner, so you can plan your meals that you're going to cook throughout the week, and it gives you nutritional information. We're always working to improve it. It's not perfect yet, but you can also do a grocery list that you bring with you. And that's all I have. Thank you.
Good afternoon. Nice to see everybody. Really thrilled to be here today to talk about a topic that is very near and dear to my heart. And I have to say, let me start out by asking, are any of you cancer survivors? I see a number of hands. Are any of you caregivers or have been caregivers for people who've dealt with cancer? So you all know a lot of what I'm going to talk about and have probably experienced and practiced a lot of this too. And I have to say, a couple weeks ago when I started thinking about this presentation, I was working from home and I looked at the table next to the chair and I was like, oh my God, there are my major obsessions: tab, chapstick, and dental floss. And I realized this morning I have those same earrings on too, so I guess the earrings are an obsession as well. Sacha talked about being passionate about food safety, and I looked at that and I thought, there's a lesson here. And I was like, you know what? That's it. I'm obsessive about food safety. I think it's such an important topic, and particularly in my career field now in working with cancer survivors and caregivers, very important. And Sacha also talked about coming by this honestly at a young age. I sat there thinking, what was it that made me so obsessive about this issue? And I thought back. Ironically, it was in Michigan. Anybody here from Michigan? Woohoo! Go Buckeyes! I remember as a child, we were vacationing on Mackinac Island, and we walked into a restaurant, and within about 2 minutes, my mother just marched us all out. And I can't remember if it was somebody in the kitchen or a wait staff. She saw them go across their face, and she's like, we're out of here. So I thank my mother for instilling that sense of food safety in me that has served me well to this day. So when you talk about trends and rates of issues in this country, our friends at CDC have published data looking at this. 48 million people get sick, 128,000 are hospitalized, 3,000 people die each year in the United States because of food safety issues, food-borne illness issues. And I'm not aware of any data that specifically calls out, older, younger, people with chronic disease, but this is alarming. And as we heard right off the bat, it's largely preventable, which is good news. So today what I want to talk about, as you might expect, why cancer survivors might be more vulnerable to foodborne illness, how people undergoing treatment can help make some changes, protect themselves, people who are caring for people, how they can protect themselves or who they're caring for as well, and also talk about some resources that we have available. Real quickly, Immune System 101, and we heard about white blood cells already, but this really sets the stage to really help understand why for cancer patients this is a really critical issue. Lots of organs, lots of cells in our body that have immune functions. They're in lymph nodes, they're in our spleen, they're certainly in bone marrow. And that's a really important point from a cancer patient perspective, talking about white blood cell formation. And you can see that these cells attack germs, viruses, bacteria in different ways by forming antibodies or working through other mechanisms with the cells together to fight off viruses, bacteria. There's many different reasons why cancer treatment might impact the immune system. And one of the first things to think about, and I know some of you who are in this room might have had some challenges eating well when you were undergoing treatment. We know it's critically important to be well nourished from an immune function perspective. So when we have people undergoing treatment who might not be able to get the nutrients they need right off the bat, that really puts them at a disadvantage from an immune perspective. We know that surgery can impact immune function. We're not exactly sure why. Some researchers think it could be the anesthesia, but we've seen in a number of studies immune function can really be impacted within 10 hours after surgery. And we know that it also might take quite some time, as you can see, for that immune system to fully recover following surgery. So surgery is another issue that has a potentially negative impact on immune function in people undergoing treatment. Chemo, and you may be aware of this. This is one of the main reasons that challenge the bone marrow and therefore challenge the level of white blood cells that are being produced and that are available to really help fight off infection. And so this is one of the things, even though we know that different chemo agents have different impacts, and they have different impacts on white blood cells versus red blood cells versus platelets, but one of the cell we know that's most impacted by chemo tends to be the white blood cells. Some people undergo types of therapy called immunotherapy. And this therapy is really designed to focus on increasing the immune system's ability to fight cancer cells, but it also has the negative impact in many people to be able to fight off other types of infections or diseases. And so even people undergoing this type, or not even people, but people undergoing this type of therapy can also have challenges from a white blood cell perspective. Radiation. We've learned so much in cancer treatment over the last number of years. We know that radiation to large, as you might expect, large bone masses, hip, chest cavity, vertebrae, those radiation treatments can impact white blood cell formation. What we've learned a lot over the years is giving smaller doses of radiation, so we don't see as much of that impact. But radiation, again, is another way that, unfortunately, can have a negative impact from an immune system perspective. One of the things I want to mention, and I wish I hadn't looked up, the billion-dollar industry that supplements are in our country today, but cancer survivors are really, really targets, if you will, for a lot of supplements that are out there. And there are a number of supplements that are purported to boost the immune system. No evidence behind that. So if you're undergoing treatment or you know somebody who is and they're taking some supplements, good idea to talk to your healthcare provider about that. Now, we heard already a lot of different tips and foods to avoid, hand washing, proper temperatures. All those things are important, certainly for cancer survivors as well. And so I sat there thinking, what are some different angles of this, additional angles to think about for cancer survivors? And one of the first things is, it's pretty soon after chemo that you can see those white cell counts drop. That is the time when somebody undergoing treatment can be at the greatest risk for foodborne illness, because white cell counts are so low. And so, as you heard about different, raw foods, not so well-cooked foods, particularly at that time during treatment, you want to be sure, encourage, support people in avoiding these types of foods that tend to harbor, again, those high levels of bacteria. Another thing to bring up, so these are symptoms of foodborne illness. What else do these look like symptoms of? Cancer treatment. A lot of people going through cancer treatment have these same types of symptoms. And so for the patient themselves, for family members, friends who are caring and supporting them, it's really important to recognize you might not recognize foodborne illness right off the bat. So it's important to think about, is there something different going on? John might feel nauseous anyway after treatment, but is this different? Is it more severe? So that's something else to think about from a cancer survivor perspective. Caregivers, friends, family. We all mean well. We want to help people. And it's really important, and particularly, and you guys have probably been part of meal trains for different types of ways to support people undergoing treatment or other types of life issues. Really important for caregivers and people who are preparing food for survivors to be aware of all of these food safety practices. Bringing so much food into the home can be a real challenge. And so ensuring that we're educating and supporting people so they understand the additional risk that somebody who's undergoing treatment might be at is really important. A couple of ACS Support and Resources that I wanted to mention. A shameless plug for our Hope Lodge. Has anybody heard of Hope Lodge before? This is a place, we've got 33 lodges throughout the country where people who have to travel for cancer treatment can stay for free. We have a lot of people who donate food, a lot of church groups, workplaces, other community groups that bring food into our Hope Lodges, that we provide this great information from USDA about food safety to protect our guests while they're there. We also have a new cookbook that's out, What to Eat During Cancer Treatment, that has a lot of information about food safety, preparing food well, et cetera. And our Complete Guide for Nutrition in Cancer Survivors is another great resource that includes all kinds of details that we wouldn't be able to get to today, but you can check that out. So this is my brother. He died last year of pancreatic cancer, and it was the very first time, truly, that I felt career-wise things had come full circle. I was at his place, and it was soon after he had started chemo, and we heard about cream pies and custard pies. He had left like a cream-based pie out in his garage overnight. Well, there wasn't room in the refrigerator for it. It's cold enough out there. I'm like, you're not eating a cream-based pie that you left in your garage overnight. I just can't do that. But it's so critically important for us to really support survivors in this way. We're all at risk for food safety, foodborne illness issues. And certainly you've heard about vulnerable some of the vulnerable, there's more, but some of the vulnerable populations who really are at risk. So I hope when you leave here today, from an aging perspective, from a diabetes perspective, from a cancer perspective, that we've given you some new nuggets to think about as you prepare food for others in your life. And I think with that I will end. Now, this is not obviously an exhaustive list of food safety resources that are out there, but a couple of ones certainly that are really great to check into and have a lot of good practical advice for everybody. Thank you.
Thank you all for talking, and Colleen especially. Thank you very much for sharing that personal anecdote at the end. I think when we all do the work we do in public health, it's really important when we think the individuals that it impacts. And I'm sure that was very, very powerful for you when you had your brother, your very close family member, who was going through something that you know so much about, but having it happen at that personal level is just something that is entirely different. So thank you for sharing that with us, and I appreciate that. So as I was listening to the three of you talk, something that Ellie mentioned just sort of got turning in my head. And so I just was going to be selfish and kick off the question and answer session with a question that popped into my head. But as I asked this, and as you folks are thinking about your answers, if others want to line up at the microphones, if you have questions for our speakers, that would be wonderful, and then we can get to those as soon as we're done with this one. So I was just curious, so Ellie talked about managing our expectations. So TV chefs are there for entertainment. They're there to engage their viewers, and it maybe is unrealistic to think that we can have them incorporate 45 food safety things that they should be thinking about into their 22.5-minute show. And I'm curious, from each of your perspectives, dealing with older adults, dealing with those with diabetes, and dealing with those with cancer, what do you think is a reasonable expectation for the amount of involvement we can incorporate into resources we have for these populations about food safety, while still understanding the American Diabetes Association, Meals on Wheels, the American Cancer Society, has missions that are about the three issues that you all talk to us about. So, I mean, I'm sure that you could devote an entire section of all of your websites to food safety for your all populations, but it just wouldn't be realistic, I think, to expect that, because there are, well, we may have 45 things about food safety we want to talk about. You probably have 450 or 4,500 things that you need to talk to your various constituencies about. So I'm just curious what your thoughts are there about the level of commitment you can provide to food safety versus the sort of primary issue-oriented focuses that you all have.
Fortuitously, our primary issue is food, so it is a little easier for us to do that. We're relaunching this year again our food safety on the go training, because it's so important to have and maintain a national standard for those who are bringing foods into the home of older folks, to have them bear that in mind, because food is our message, food is our mission, and food safety is an integral part of that. So I think we are well able to work with our client, and our client is the provider of meals to seniors, to help raise their food safety awareness and align their practices with best practice.
Yeah, and I think I agree. I mean, what we do at American Diabetes Association, we produce a lot of cookbooks and a website about food, and diabetes is so food-focused that it's important. I know we encourage our diabetes education programs to utilize the USDA booklets on diabetes to provide more information, and we have increased working with the USDA on our Food Hub website and are looking to do more engagement campaigns, more interspersing it throughout versus a page that people maybe wouldn't go to.
Interesting.
Sort of raising awareness regularly and then directing them to your resources, which are great.
Interesting.
Yeah, and I think that, and it's a really good question, and I like the way you posed it too, because I feel like across the board, if we're working, with media experts, I think as professionals we've got a responsibility to ensure, one way or another, some food safety tips get into that show, session, whatever. And then as I see it, thinking about this, from our individual organizational perspectives, we work with a lot of chefs who work with oncology nutritionists. And so, through those relationships, we communicate some more specifics, that go beyond just the general, food safety tips, for the general, public. And same thing working with chefs in other cancer centers. And it's a little easier because they know, how important that is from a survivor perspective. But I do think it's a responsibility. I think it's an important issue, especially when you think about, you look at those CDC stats of people who are hospitalized, who die, who experience this.
So, Uche, you also mentioned in your presentation about the formats that your audience, that 65 and older population, actually consumes media, and broadcast media, what they see on TV is what they consider most trustworthy, and that's where they turn. I'm curious, Sacha and Colleen, if you have any information on where your constituencies turn for information, and where some of that food safety guidance might be able to be targeted and built in so that they're hearing it from the authority figures that they trust when they turn for information and news.
Yeah, so with us, we've got a lot of information that targets healthcare providers. I mean, a lot that targets consumers that has food safety information in it. But we've got real strong relationships with healthcare providers and healthcare organizations. And so some of our work gets communicated via that route. I will say, to be honestly, we don't have a good sense at ACS. We don't have a good sense of how much of a concern this is for people who are coming to us. But we feel a responsibility that we need to educate and support them and be sure they understand the challenges that they can face.
Yeah, I would agree. I mean, we work with educators who are working with people with diabetes every day, and they're often dietitians or nurses who are all talking about food and nutrition because it's so important. So educating them, I think, is key. And because we haven't done that research, and I'm sure a lot of our population is the same group. But we also know that one thing we found is people do like that personal connection. So something they just hear on TV may not be as reliable unless it's that show that they trust or that person that they trust. So, but that would be interesting research. We should look into that.
So other questions
Yes.
from the audience, please come on up. Dr. Brune, thank you.
So let me begin by saying I highly respect your professional expertise in working with diabetes and working with target audiences that are at high risk for foodborne illness. Consistent with what we had heard stated earlier, and you even repeated now, sometimes you can't be an expert in everything, and if you hear something that needs to be rethought, you shouldn't be silent. So please, I respectfully request that you reconsider your advice for people to re-wash pre-washed greens. Now, the reason here is multifold. Most consumers don't wash their hands. Most consumers don't wash their sink before they wash their hands. And when they wash the produce, their produce is likely to be contaminated from those two sources. Secondly, when the produce has been pre-washed in the facility, it has been washed with chlorinated water, dried, and then packaged. If any bacteria that is on the surface that can be removed by washing would have been washed. There could be other bacteria still sitting there. It's in the little crevices, it's in the stomata. It's not coming off by washing. So it's not saying it's sterile, but you aren't making it any cleaner. And you're likely to contaminate it. And this is not just Christine saying this. A peer-reviewed paper of a group of experts came up with this recommendation. And if you'll give me your card, I'm delighted to send you the reference. And I wouldn't have spoken, except many of us deal with people with these comments. And so and you haven't done the, you don't have time to look for everything. So,
Right.
so please respectfully I respect you, but this is just one area you might want to rethink that. Thank you.
Thank you.
Oh, go ahead.
Just a question. My mother's a recent survivor of a very rare cancer. While she was undergoing immunotherapy, she was on the ideal protein, which had basically no sugar. And while her doctor said he would never admit in public, he thought that the lack of sugar helped. Do you know of any resources or locations of journals for research on that?
Yeah, there's a lot. And that is one of the, if I had to give the top 5 lists of issues that come up, that's one of them. Check with me afterwards. I will send you a couple different articles. But one of the things that there's this thought that sugar really feeds cancer and feeds tumor cells, and a lot of us here are nutritionists. We know that sugar feeds every cell of our body, and so that's an example of taking an evidence-based fact and kind of translating it in different ways. But a lot of healthcare providers absolutely do recommend no sugar, but there's really not good evidence that it's doing what people think it's doing. But I'd be happy to share a number of articles and resources with you.
Thank you.
Sure.
Like Christine, I thought your presentation was really fantastic. And I mean, I've had to be a caregiver to older parents, and they're deceased now, and I know some of the challenges you talked about are really hard. And I have a dear friend who just went through chemotherapy, and myself, I'm immune compromised, so I have to be, careful with the things that I eat. You mentioned the idea that you need helpful tips, for how do people handle their food. And I think many of us in the room could give you some helpful, tips that we personally think are important. But one of the gaps in our system is the lack of consumer behavioral research. And it would really be great if Meals on Wheels or the American Cancer Society or the diabetic group would make sure that ARS and the National Institutes of Health are aware of the fact that we need more consumer behavioral research so that we have some validity when we offer tips. Like my personal tip, I would like to see all caregivers or anybody that's preparing food for cancer victims or diabetics, when they go into the grocery store, that when they select their meat or poultry product, they don't handle them with their hands. No, they should take the plastic bags, put it over their hand like a glove, then pick it up and stop the cross-contamination. I don't know of any study that supports that. So your 3 organizations, though, have a very powerful voice, and pointing this out to the governmental research centers that we need this type of research would be helpful. So thank you.
I love that
It's a great
idea. I
comment.
like that suggestion.
Absolutely.
And I like your tip too. I never would have thought of that. And I was thinking earlier, I was at a grocery store one time, and you know those produce scales in the produce department? I saw somebody put their baby in it with just a diaper and a t-shirt on. And I was like, whoa, that's not enough reason to watch things. I don't know what is, but I like that tip a lot.
So I'm Shelley Feist. I just wanted to ask, you all probably are really experts in how to communicate with your at-risk group. Are there any tips you would give us about medium, opportunities, maybe community-based organizations that you think are very strong to reach your population? I think Uche's is maybe a little more organized, but I know there are other networks you all have on how we could do better getting food safety to these people.
We're all looking at each other. Okay. Media. Well, certainly, I think the use by older adults of technology, I think, is not always uniformly understood. And so I think there are opportunities there to leverage more channels through technology, more social. Of course, we're more web-based learning, e-learning as a modality to reach older folks, particularly those who are not able to leave their homes, who also need access to information. So I think those are great channels to use, and there's growing research from Pew and others as to the growing interest and use of technology by older adults. So I would put that out there so that it's not just the pencil and paper approach or the need for hard copy curricula, that we can move into more e-learning as an opportunity.
Yeah, and I would agree. Some of our research shows that our older adults are using. First, they were using desktop desktop computers, but now we're seeing really mobile stuff is about the same. But we have an initiative at ADA. We have recognized programs all over the country. They're not ADA, they're ADA recognized. So getting that information out to them is very important, and so that's something that I can help us do, because I lead those programs. And we also have an Ask the Expert series, which is a really interesting concept. And it's one of my favorite things I've done since I've been to ADA. It was supposed to be a webinar format where it was a Q&A for people with diabetes to ask their questions of experts. Similar to this, only it's phone-based. But we thought we had phone and webinar. After the first year, we realized what we found out was majority of the people were calling in. And so we thought, wow, we're reaching people that nobody is. And we do surveys. We do outcome surveys. So we check beforehand their knowledge and then after their knowledge. And so there may be opportunities in that realm to talk about food safety as well.
Yeah, and we use some of those very similar approaches as well. And we also, looking at partnering with other organizations, and I'll just throw out an example. We work with the National Y, and we work with them on a physical activity program for cancer survivors. And we're looking now at how can we add a caregiver component and a nutrition component to this Live Strong at the Y program. And so we really look at leveraging some of our other community-based relationships who are regularly communicating, with patients. We work with a lot of federally qualified health centers and work through their infrastructure to help communicate this issue, and certainly look at how we can, and I've been thinking even more ways after listening to my two colleagues here, better ways for us to incorporate some of this information into our own, into more of our resources, I should say. And one other thing I'll just mention, talk about doing surveys. We're getting ready to do a variety of different focus groups with dietitians who work in a lot of different areas. And with the oncology dietitians who we'll be talking with, this is one of the things that we're going to be probing them about in terms of how do we better communicate to survivors, caregivers, healthcare providers, et cetera, about the issue.
And I'll just add to that is I got a lot of pushback when we originally connected with the food safety group at USDA internally in my organization. They're like, nobody wants to know about that. Why are you putting this out there? So it was a little bit of a push, and I could resonate with what Ellie said, is that they were like, no, we're not talking about that. But we finally got it on our website, and there's definitely more openness to it now. They understand the need,
So I think this is we have one more question. Last question.
Thank you. I'm Ellen Evans from the Food Industry Centre at Cardiff Metropolitan University in the UK. just listening to you, it makes me feel that there's a need for an approach to be sort of about food well-being. It's not just about food being safe, it's that it needs to be safe and nutritious. It's one plate of food, it needs to do both. My question relates to all the all the groups we've been talking about, the older adults, the chemotherapy recipients and people with diabetes, is do these groups that you work with, do they perceive themselves to be at an increased risk of foodborne infection? And is this a barrier to communication for you? And what can the food safety educators here do to sort of overcome some of those barriers? Thank you.
Well, certainly. There's a lot of conversation around food safety risk and perception among some of the older adults. There's some programs and based on some of the state statute that would have challenges with older adults, say, who go to a congregate dining center, have a meal, and some folks are incredibly enterprising and they bring a little margarine tub and they would like to take some of the food home in the little margarine tub. Well, that is a bit of a challenge, particularly you want to make sure that they can transport those food safely home, store them quickly. How do we overcome that? And so there's a lot of conversation about how do we do this. These are older folks, successful agers. We want them to bring the margarine tub, take the food home. They're very happy to do that. Some programs are able to provide some guidance in the form of a sticker so they can go home and manage that food well and transport it and store it safely. Others prohibit the margarine tubs. There's searches of the persons to see if there are margarine tubs in there. We need to find a way to really address food safety. This is why we were approaching curricula to have a national standard so we can create and ensure that dining sites are welcoming, engaging, margarine tubs for everyone, just to make sure that we provide nutrition, the correct education, because older folks often don't see themselves at risk and do put the margarine tub on the radiator to keep it warm just for a little while and go and do something else and come back. We can address that. So yes, risk perceptions are challenging. Programs are dealing with successful agers who need to be treated with dignity. We can provide the right information so that they can manage their individual food safety risks well with the information that we provide.
And with diabetes, I think a lot of people, it might be mixed. People think they're at risk if they've been sick in general, but if they're healthy, diabetes being a chronic disease, people are living very healthy with diabetes and would not see themselves at risk. They do like to use this as an example why they don't want to eat vegetables, though. And so that's what we try to overcome, is making sure, they say, oh, what about all the scares? And so they're very aware. I'm not sure how aware they are of their own risk.
Yeah, and I think that it's very similar with survivors, and I'm thinking about caregivers. We have information. We support people undergoing treatment with this type of information. And again, we talk to healthcare providers about it, but we really feel like a really unique and important angle for us are caregivers. Because, and those of you who raised your hands as being cancer survivors, when you're going through treatment, there's a lot on your mind, and food safety might not be top of mind. But the people caring for you, they want to do everything they can to support you and help ensure that you're getting, the best treatment you can, that you're being taken care of as best, you can be taken care of, and providing food is an important angle there. And so we're really looking at, again, with the Live Strong potential caregiver angle, with leveraging all of the caregivers, hundreds of thousands of caregivers who come through our Hope Lodges every year, ensuring that they really know what's really important to be paying attention to and thinking about as they prepare food for their loved one.